Hello, and thanks for your interest in the Oregon Health Insurance Marketplace Community Partner Program grant. If you're seeing this page, you're in the right place in the Community Partner Resources on OregonHealthcare.gov. In order to find the materials necessary for the grants, you'll have to scroll down to the bottom of the page, and you'll see 4 different links to the 4 documents you need to review and submit in order to be considered for the grant. The first document to review is the 2018 DCBS Community Partner RFGP, and the number for that RFGP is DCBS 1477-17. Click on that document for more information. Once the document opens, you'll be able to see a description of the Community Partner RFGP. If you're seeing the following document, you're in the right place. Please note that this document was issued on June 1st, and our proposals are due by July 3rd of 2017, with an anticipated award of September 1st, 2017. In order to submit your documents, you'll need to submit the proposals via email to dcbs.opportunity@oregon.gov, and the single point of contact for the proposals is Margarita Nunez, our procurement specialist at DCBS. We'll quickly review the different sections of the RFGP to make sure that you're clear on what each of them mean. The first section is just the purpose and overview of the RFGP. The next provides some background on the RFGP, including funding availability. Please be sure to read the funding availability section carefully, as it describes the amounts of grants that are available as well as the grant cycle and some expectations, including what our grant recipients are going to be expected to accomplish during their time as a grantee of DCBS. The next section describes the scope of work, which provides outreach and enrollment definitions and the benefits of receiving a grant from DCBS, including the requirements as well. There will also be metrics described, which will be what you'll be reporting out monthly when you receive the grant, as well as some important notes, the value of the grant as well. New this year is the add-on of the COFA Premium Assistance Program. Rather than a separate grant, the COFA Premium Assistance Program has been included with the Community Partner Grant, and as an optional add-on, you can apply for that funding as well. This section describes the COFA Premium Assistance Program, as well as the scope of work and what your expected metrics would be. The rest of the RFGP describes certain priorities that the marketplace has for grantees, as well as some standards. It's important to read all of the information carefully on the RFGP, and be sure to reach out to Margarita with any questions that you might have. Another important section to read carefully and consider is the evaluation and awards section. All of our proposers will be evaluated based on certain criteria, and this section will also describe how awards will be announced and how they'll be received by those who are selected. The final section to make sure that you consider before applying is the term of the grant. This grant cycle will be September 1st, 2017 through August 31st, 2018. The next document to review, and it will be necessary to submit, will be attachments 3 through 5, technical proposal, budget, special consideration submission form. Click on that link next. This is the document where you'll actually provide the information for your proposal that will be considered by the scoring committee. The first section is about qualifications and experience, and it's worth 25 points out of the maximum available. The first question states existing relationships and positions of trust with the populations you propose to reach. What we're looking for here is how you are able to reach certain populations and what experience you have working with them. Obviously, it's a priority for DCBS to reach populations that are underserved by health insurance and health coverage, and we want to make sure that any community partner that we're working with has the capability and experience of working with underserved, disadvantaged communities. So please, in this section, describe how your organization has done this in the past and what sort of trust relationships you've built with these types of communities. The first question on page 2 asks your experience with outreach strategies in support of health insurance enrollment, including an assessment of the effectiveness of those strategies. Here we're looking for specific strategies you've used with outreach, and we want you to be honest about how effective those strategies were. It's fine if not everything is worked out in the past, but your ability to understand how effective strategies work and what hasn't worked would be appropriate in this section. Question 2 asks staff successes and challenges conducting outreach to your audiences, including information about how outreach strategies you're planning may be affected by the nature of the regions you're targeting. As you work with different communities, you may come across different challenges, and you may be particularly successful with those communities in your region. Here's where we want you to go into those details about the communities that you're trying to serve, the region that you're trying to serve, and what you anticipate to be the particular challenges that you might encounter, as well as how you might overcome those challenges or specific strategies that you might use that you think will be very successful. Please be specific and use as much detail as possible. As a DCBS grantee, you may be called upon to help develop promotional or information materials to help with your outreach. Or you might actually have outreach materials you've created at your organization. This third question on the second page asks you to describe your experience creating or using promotional materials in your outreach. The first question on the third page asks about experience with collaborative community actions. In this section, we want you to describe any time that you've had to collaborate in order to achieve your goals with other community partners, with other community groups, any time that you've had to come together with a group of folks in order to accomplish some sort of goal. This includes partnership with other state agencies, with DCBS, with OHA, with other community-based organizations or nonprofits, any time that you've had to work or your organization has had to work with other organizations. The second question on the third page is all about enrollment strategies. It's very similar to the previous question that asked specifically about outreach. Here we want to hear what strategies you've used in order to help folks enroll with health insurance and an assessment of the effectiveness of those strategies. Again, it's not important that every strategy that you've used has been successful, but if you understand why it wasn't successful and can explain why it wasn't successful and what you might do differently, that will be considered as well. The final question on the third page is very similar to the previous outreach question about successes and challenges providing enrollment assistance to your audiences. So we'd like to know what strategies you used and what sort of specific successes and challenges that you experienced, as well as what you might be facing in your region specific to enrollment. The first question on the fourth page, which is the final question in the qualifications and experience section, asks about your experience promoting enrollment support, including an assessment of the effectiveness of your promotion efforts. In this section, we're looking for information about when you provided enrollment support to the community, what you did in order to make sure that the community understood that you were available for help in enrolling in health insurance, and an honest assessment of how those promotion efforts went. Section 2 is about your grant plan. So shifting focus from how things have been in the past, we want to know what you propose to do this year for the 2018 open enrollment cycle. There's a 50-point maximum for this section. The first question asks you to explain how the project, meaning your proposal, expands your current work at your organization and how you'd use the grant to create new outreach and enrollment model for your organization. The first section asks you to essentially describe how this coincides with the work that you're currently doing and maybe how it would expand your agency's mission. The first question on page 5 asks you to specify the audiences you intend to reach. Here's where you describe the specific communities that you intend to serve. It could be multiple communities. For each audience or community that you intend to serve, the next question asks you to provide specific goals for each of those audiences, which include activities and major milestones and dates you expect to reach them, as well as success measures for each goal. Page 6 provides more spaces for more audiences and more goals, more activities, and more success measures. Feel free to add additional pages if you have more audiences that you want to reach in addition to the pages that are already provided. While the last few goals were associated with outreach, page 7 shifts the topic to enrollment, and you want to do the same thing that you did in the previous pages. Identify the audiences for your enrollment goals, provide goals for those audiences, provide activities and the dates you intend to achieve them, and then provide how you'll measure success for each of those goals. Just like on page 7, page 8 provides more spaces for you to provide additional audiences, goals, activities, dates, and success measures. The last question on page 8 asks you to provide the names and titles of the staff that will be working directly on this project, conducting outreach and enrollment assistance. If you plan to hire anyone, please list their position titles and expected dates of hire. For those staff that you've identified that already work at your organization that will be working on this proposal, please also provide the portion of FTE that will be working. The first question on page 9 asks you to provide specific information about the service area you'll be working in on this grant. We'd like to see city and county information. It's okay to identify multiple cities and counties for this section. The last question on page 9 asks you to provide specific outcome targets in several areas to be completed by the end of the grant cycle. These numbers will always be considered a starting estimate and typically get adjusted mid-year depending on how outcome targets are doing at the time. The first question is the total number of new applications assisted. These are folks that did not previously have health insurance. The next question is the total number of renewal applications assistance. These are folks who had insurance and are coming back for additional help. The next question is the total number of applications for qualified health plans. We're looking to try and determine how many people purchase plans on healthcare.gov. The next question is the total number of in-person networking meetings attended to promote OHP and QHP. This is generally situations where you meet with someone, tell them about how your program is promoting enrollment, and get connected to a group of individuals. This could be a church group, it could be another nonprofit that you will go and speak in front of. Whatever the situation is, the person will give you access to another group of people. It's generally a more person-to-person meeting than any type of public speaking. The next question is the number of outreach contacts, which includes tabling, advertising, social media, news media, radio, etc. With outreach contacts, we really want to know the number of people that could have been connected to your outreach. Meaning, during tabling, we're looking for the number of folks that you connected with face-to-face, but in advertising, social media, news media, or any of the other types of media, we're looking for the proposed reach for each of those categories. The last question is the total number of brochures, flyers, and other materials distributed. We just want to know how many materials you've sent out or you've handed out to folks. Page 10 moves us into the budget proposal section, and there's 25 points maximum available for this. There's a key that gives you information about how to correctly fill out the budget, but generally the sections are all highlighted. Staff salaries and benefits, travel, outreach and enrollment services, supplies, indirect expenses, and other. Be specific in your itemization of expenses. And again, remember that this is just a proposed budget, and if you are selected as a grantee, there will be a negotiation process by which we determine what the actual budgets will be. These budgets will also be somewhat flexible in that we'll be able to move line items if necessary, if it's determined that what was proposed is not effective. Page 13 is attachment 5, which allows you to provide some items of special consideration, which will give you 25 points maximum. The first question in this section asks you to describe what types of multiple language skills your organization is capable of. Since we want to be able to provide assistance to folks from many different cultures and people who speak many different languages, it's helpful to know what sort of support your organization has for speaking multiple languages. The following question talks about cultural competency or cultural proficiency and your experience working with certain groups. If you could describe your experience working with specific groups, you may be considered for additional points. The last question asks you to describe your existing relationship with Oregon Health Plan assisters or your plan to develop a stronger relationship with the help of DCBS. Because we want Oregon consumers to be able to be helped by anyone that they come to for assistance, and that we want no wrong door for consumers, we'd love to know how you intend on assisting not just folks who apply for qualified health plans, but those who might qualify for Oregon Health Plan. Please provide that information in this section. If you'd like to be considered for the Compact of Free Association Premium Assistance Program add-on, please click on the next link labeled Attachment 6. The COFA Premium Assistance Program, or CPAP, is for adult COFA Islanders that are at or below 138% of the federal poverty level who do not qualify for Medicaid or other minimum essential coverage. This Premium Assistance Program helps COFA Islanders pay for their health insurance with a qualified health plan through healthcare.gov. This section will describe how to apply for the COFA Premium Assistance Program grant. The first question asks you to describe the methods to target the COFA Premium Assistance Program target audience. Please be specific on how you might be able to reach that audience and what effective strategies you'll use in order to do that. Question 2 asks you to provide outreach and enrollment assistance goals with clear milestones and well-defined methods for measuring success. Very similar to the Community Partner Program, we'd like you here to describe specific goals, dates to accomplish them, and how you'll measure success for each of the goals. Question 3 asks you to identify and address potential challenges specific to the COFA population. If you are aware of specific challenges that this population might face, we'd like you to describe it and be specific, as well as how you might overcome those challenges. Question 4 asks you to describe how data required for event reports will be tracked and collected. If you are interested in creating enrollment events for the COFA population, we'd like to know how you will be tracking those folks who attended, as well as how many applications were submitted. Question 5 is again similar to the Community Partner Program grant. We'd like you to describe any past experience you had with proven outreach and enrollment assistance strategies. The experience does not have to be specific to the COFA Island populations. You can talk about other communities that you serve and how successful you were in serving them. The final Community Partner Grant document is the RFGP DCBS 1477-17 checklist for proposals. Let's click that. This checklist is really intended as a guide for you. Follow the steps on it and check them off as you complete them in order to make sure that your proposal is complete before you send it in. Again, email your proposal and all attachments to dcbs.opportunity@oregon.gov.